Good afternoon, everyone, and thanks so much for joining us for day 2 of the EHS Daily Advisors Worker Safety Now. I hope you all enjoyed the content of the last 2 days, and we have another fantastic session in store for you right now entitled Designing an Effective Workplace Injury Management Program. Today's session is sponsored by our friends from Examinetics. Examinetics is the nation's leading provider of occupational health solutions, offering services across the entire employee lifecycle, ranging from pre-employment needs and periodic assessments to injury management and annual compliance testing. Their comprehensive service offering is delivered in 3 methods: on-site visits, a near-site clinic network, and on-demand technology platforms. By offering a wide range of service and delivery options combined with concierge service, their clients reduce overall business disruption, lower labor and compliance costs, and minimize productivity loss. If you do wish to learn any more about our session sponsor, Examinetics, you can hop on into the resource widget on the left-hand side of your screen for more information. And speaking of that resource widget, there is a great free white paper provided to you by Examinetics, so don't forget to download that before the end of our presentation. It's all in the resource widget for you. And with that, everyone, let's dive into some housekeeping items before I pass the presentation over to our guest speaker. So the console that you're looking at right now does offer a few different application widgets to use during our session today. The most important widget on your screen is called the Media Player widget, and this is sitting above the slides right now. This is where you can control the volume of today's presentation. Please take note that there is no dial-in number for our attendees today, and the audio is streaming directly from your computer speakers, so please be sure they're turned up and on. You don't want to miss any part of our session today. However, if you have to step away for any reason, or if you do miss any part of our session, we are recording it, and a copy of the recording will be sent to you via email in about 24 hours. In the event that anyone on the line today has any type of technical difficulty, please feel free to let me know the issue that you're experiencing by hopping on into the Q&A widget on the left-hand side of your screen, and I'll be happy to assist you today. And speaking of that Q&A widget, we're really excited to hear from you today, and we're going to be hosting a live Q&A session at the end of our presentation today, so I hope you all came with questions for our speaker. Feel free to submit any questions on today's topic at any point throughout our event, and we'll get to as many as we can at the end of our presentation today. Okay, and with housekeeping out of the way, I would like to introduce our guest speaker to the floor. Here with us today, we have Mike Bells, Vice President of Health and Safety Solutions at Examinetics. If you wish to learn more about Mike, you can hop on into the speaker bio widget on your screen for more information. And with that, Mike, I'm going to kick it over to you to get our session started.
Thank you very much. Good day, everybody. I appreciate the opportunity to speak with each of you. This is an area that I'm very passionate about. I feel like it's an area where most employers really want to get better at. They want to make sure that they are not only meeting the needs of their employees, but also doing it in a way that is beneficial to them as well. And through this program today, we are really going to be focusing on the different aspects of not only how you want to set the foundation of your program, what is some of the critical needs that you need to evaluate, not only to look at some of your historic data and understand why and how these injuries are occurring, but how is it impacting you? And then, of course, we want to look at when you find those areas that need to be addressed, how do you design an effective program that is meeting all the specific needs of your company? Because every company is different, and you will even see that different job positions have different requirements, different sites have different requirements. And then most importantly, we're going to be looking at the implementation of an effective program as well. This is very important to take into account all the different facets of looking at the key elements that each company has to address when they are implementing injury management protocols and procedures for their employees. So when you look at the different aspects, most companies will see that dealing with an injury can be a pain. It can be a very disruptive element to your workday. And by looking at your entire injury management program in totality, we want to look at the different aspects and how a program can positively impact that. First and foremost, when you look at the different elements, especially when you look at the foundational information, we want to look at how can you reduce or prevent injuries. I am definitely of the mindset coming from the safety side, you're not going to be able to eliminate 100% of injuries, which is where other facets come into play with key elements of how you incorporate services. But there are a lot of foundational elements you'll see that can help reduce as well as prevent injuries, which is very important. Another key objective always is to lower your cost per incident. When you look at the different aspects of work-related injury treatment, it is a direct overhead cost. So every dollar you can save in making sure your employees are getting the proper care in the proper fashion and doing it in a cost-effective manner will just add to your bottom line. An important element for so many companies is to really reduce as many of those recordable events. A recordable, whether it be under OSHA or MSHA regulations, can negatively impact you in so many different ways. It impacts your experience modification rate. Depending on if you do project-based work, it also can impact your ability to secure additional business because of your safety status. So we want to make sure that we position you to develop programs in such a way, especially around how you set up your foundation and how you may use services like teletriage to really reduce those recordable events. We also want to look at how can we develop a program for you which will reduce your loss of productivity. When you look at manpower away from their standard operating procedures, that is a direct impact on the operational revenue generation that you have. So if you can implement certain aspects, such as making sure that you've developed your job description so everybody understands the essential functions of their job, which will impact your duty status. If you look at how you can use teletriage or a procedure that reduces the time your employees are away from the job site but still receiving medical treatment. Anything that we can help you accomplish in reducing your loss of productivity will have a huge impact. And I always like to follow up that one of the key areas of any injury management program is making sure your employees are receiving that proper medical attention. They are one of your number one assets to your business. Without employees who are functional, you are not generating revenue. And the other part of it is that by developing a program that also takes into account your employees' needs, they feel like they're getting the proper attention. And by creating that culture that the employees always feel that the company is working in their best interest, will then allow them to be more compliant. They will be a more willing participant, and I guarantee you will have better outcomes. So one of the biggest things that I think is always an important aspect is from a research standpoint, understanding your business, understanding the who, when, where, and why injuries are occurring so that you can start looking at how you implement this. One of the key resources that I think is so critical is the proper evaluation of your last 3 years loss run data. This is something that you will work with your insurance carrier on to get critical information that you should really be reviewing on a quarterly basis so that you are understanding the trends and tendencies that go into what is creating these opportunities for a work-related injury. One of the things that I think is very important as you work with your insurance provider for your last 3 year loss run data is really try to get them to provide you critical information so you can look at trends and tendencies, making sure that you not only have the employees, the data, the incident, the type of injury that was sustained, what were the outcomes, did it result in time loss versus restricted duty or full duty, but also try to get them to incorporate things like their start dates. And this is really important because you also want to start identifying where in the employee life cycle injuries are happening. Do you have a high volume of injuries that are happening in the first 90 to 120 days? Or do you find that most of your injuries are happening towards the longer duration that an employee is being with you? Those things combined with your incident reports is very important. Your incident reporting should be something that is a very standardized process because it gathers key information. I know companies have two basic rules of thumb on incident reportings. I see a lot of clients out there that will just do a narrative via email, which I'm not a big proponent of because it doesn't always capture the same data the same way each and every time. If you don't have a standardized incident report, it's something I would feel that you will get a lot of value because it's ensuring you're gathering all the same information for every single incident. You are able to track that information. You will also be able to see what are some of the contributing factors that may have led to a negative outcome on an injury. Some of the most common areas of contributing factors that will negatively impact how an injury is managed is timely reporting. We see that quite frequently. You have an employee that might come in on a Monday and say, oh, by the way, I tweaked my back 2 weeks ago. Now I need medical attention. Timeliness of reporting, timeliness of getting the medical attention has a significant impact on the plan of care that is prescribed. So through your incident reports, if you are able to basically identify and document not only when the incidents are occurring, but when they're being reported and when medical treatment is being provided, it may provide you some real critical information on how we want to structure the program moving forward. The other part of it is compliance to your current program and what your current program entails, which is what we're going to start getting into, because really how your program is structured must be taken into account whenever you are looking at how you want to basically advance your injury management program. So what are some of the biggest things that we have to look at foundationally for every single client? As a client, you should always be looking at aspects such as your hours of operation. This is a significant impact. If you are a single facility and you operate 8 to 5, obviously your ability to manage your work-related injuries is much more simplified. You can tie into a very well-suited occupational medical clinic to be your assistant in the process so that you can have good outcomes. But not all situations are that way. You might be a company that has 40 locations around the country, and now you want to be consistent with how everything is being managed. Or you may have a combination of brick and mortar locations and project-based. This is where we start getting into some complexity, because when you deal with project-based, especially if you're going on to a client's facility, now we have to look at site requirements. And we also have to start understanding, based off the state you're operating in, you have to take into account what are the state guidelines and regulations, because you are going to see variations where in some states, you as the employer or the insurance carrier get to direct care. You have other states where the employee is allowed to direct their own care, or you have panel states like Georgia and Pennsylvania, Tennessee, Colorado, where in order for you to be able to direct care, you have to provide a panel of clinics from them to select to. But in addition to that, you also have to see if that project site that you're working has different reporting regulations that you have to be compliant to. So these things are all very important, that even though you may have that top level corporate structure, as you move down into your individual sites as well as potentially project-based, you'll see it gets a lot more granularity, where you have to look at reporting. You have to look at, are there going to be drug and alcohol requirements? You may also go and work on a project site that is managed through an owner-controlled insurance program or an OSA. That changes. So what you're going to do is, beyond that corporate policy, you need to make sure that you have site safety plans and your injury management program set up accordingly so that you can take all of these into account. Now, when we look at the adherence to specific guidelines, there are the federal and state, which we talked about with the state panels as far as for directing management of care. You also have to be aware of where your control starts and ends. For instance, the state of Illinois, you as the employer get to direct care for the first visit, but after that, the employee does have the right to seek out their own treatment plan if they don't feel like they are getting the proper guidance and adherence by you. You have states like Michigan where you get to direct care for the first 27 days. Or you have states that are very advantageous to the employer, like Indiana, where you get to direct care for the first 500 weeks. So we want to make sure that you take that into account. From a drug and alcohol standpoint, the only real adherence that you have to do there is anybody that falls under the federal DOT regulations for CDL. There are very specific provisions for structuring post-accident, post-incident drug and alcohol testing for citationable events. You want to make sure that that is not only written into your policies, but you need to make sure that your staff knows how to basically implement that testing when it's needed. Again, we talked about taking into account client-specific requirements that you have, as well as if you have union employees, you will have to make sure that you've reviewed the collectively bargained agreements. You need to make sure that you're being compliant with all their regulations and guidelines. Who's in charge of the drug and alcohol? Who's in charge of the reporting? Do you need to make sure that the union steward is involved? We want to make sure that you understand these aspects to write into your safety plans so that you're making sure everybody on your team knows exactly how to perform anytime a work-related incident does occur. When you look at the final elements that go into structuring your program, it's the understanding of your internal versus external resources. You look at what your desired outcomes are, and then you have to start understanding is, do we have the subject matter expertise internally to be able to provide this type of guidance? Most companies do not have clinical elements. Sometimes they will have an internal nurse or a clinical advisor, which will give them different capabilities. If not, you might be looking towards either your insurance carrier, a TPA, or a third-party vendor who can provide both teletriage and case management to supplement those activities, as well as making sure you have the proper administrative staff involved as well. Because if you're going to manage some of these activities internally, do you have the means and do you have the program structure to put together the authorization for treatment? Do you have the proper staffing to follow up with clinics to get duty status information on employees that went in for care? Because the last thing you want to do is have an employee return from a medical visit. They're ready to go back to work, but you don't even have the notes back from the clinic yet, and you don't know how to utilize them. These internal resources will not only play on how you may utilize external resources, but how you structure your program to utilize companies that can help you from a teletriage standpoint, as well as from the standpoint of managing these clinics on your behalf. Now, as you do that internal resource evaluation, this is where you're going to start understanding and identifying the capabilities of your external resources, whether it's your insurance carrier, what they do and how they assign adjusters to your case. Because if an insurance carrier, and we see this quite frequently, take between a week and 2 weeks to assign an adjuster in some scenarios, your employee might be having 2-3 follow-ups at a clinic during that time frame. Who is helping you manage that? Who is speaking on your behalf, not only to make sure these cases are being managed properly, but interacting with your employees to make sure they're having a good experience? If you're utilizing a TPA in conjunction with your insurance carrier, what are their roles and responsibilities? And do they understand all the different facets of your environment so they can work on your behalf? And when you understand the combination of your internal resources plus what your insurance carrier and if you use a TPA can provide to you, that's when you'll start entertaining and interviewing vendors such as a teletriage service, case management, claims investigation, claims administration, to assist you work through these difficult situations to, again, find that good balance between good patient care as well as making sure your interests as the employer are being protected. So as we get into this, teletriage and case management can be very effective parts of a program, and we'll definitely cover that here in a couple minutes. But in order to provide the proper guidance in any scenario, whether you're self-administrating this, even working with your insurance carriers, I cannot stress to you how important it is to have very good, fully functional job descriptions that fully lay out the essential functions per job description, not only with their physical requirements, but also with the frequency in which these are performed. These become a roadmap, because the thing is, as much information as the medical providers can have, understanding the essential functions, the physical requirements, and frequency can have a huge impact on duty status. Most companies work within the standard 3 of full duty, restricted duty, and time loss. But if you have a fully described job description that takes into account all the primary tasks as well as our alternative activities, and a lot of people in their job descriptions have alternative activities. They may be a hole wash, they may be a spotter, there may be administrative functions. It is critical that you include those into your job descriptions because it affects the duty status significantly. Because we want to play within the guidelines that OSHA and MSHA provide us. But in order to do that, you need to have very functional and fully descriptive job descriptions as a roadmap so you can use them as the guidance for any medical professional that is assisting you through your injury management program. As we talk about a lot of the foundational elements we have on the previous slides, this is where we start getting into what are the components that you as an employer need to entertain as being part of the program. The first one that I'm a big advocate for is teletriage. And the teletriage is a capability for you to provide medical assistance to your employees in a remote fashion. They typically will be involved in dealing directly with your employees, assessing the significant nature of the injury, developing plans of care, all through interaction through the phone. It could be through a video conference like what we're on today, to provide them all the proper medical attention they need without the need of ever leaving the job site. Now, when you're entertaining a teletriage program, it's very important as you're interviewing different vendors for this, you want to be conscious of the differences between teletriage, telemedicine, and telehealth. The reason I always use the term teletriage is the vendors that fall under this category segment are always providing care under the first aid umbrella. Everything under teletriage is first aid. Nothing will trigger a recordable event. When you get into the services that may provide care under telemedicine or telehealth, the issues that you may get into with that is those are services that are provided based off of state guidelines, which means those providers can also then prescribe things like prescription medications and other plans of care that could trigger a recordable event. So when you're looking at teleservices, it's very important that you understand the services that each vendor provides. And I highly recommend you find one under the teletriage because I think it's more advantageous for businesses with injuries. Case management is the ability for a provider to provide you clinic-based guidance, whether it be from the management standpoint of the clinics, also staying involved in managing, the opportunities with you and your insurance provider, as well as your employees. The goal here is to create consistency amongst all your job sites so every employee gets a very similar experience, but now you have a medical professional working on your behalf so that you get the best possible outcome. Various claims services that you may want to entertain. You've got claims investigation, and then you have claims administration. So if you're a company that either has a high deductible insurance program, you may be self-insured, or you just may be an employer that also is very conscious of having to monitor your mod rate. A lot of clients will use claims administration to self-pay claims, which would allow you to take advantage of a discounted fee schedule. But it means that you can do this in a way where you're not going to file the claims with your insurance carrier, so that in this case, your frequency of reporting goes down, which will positively impact your experience modification rate. Claims investigation is a service that can be available to you to help investigate claims, whether it be to check the validity to make sure whether you're going to accept or deny the claim, or it could be even a scenario where you will be accepting the compensability of the claim, but you may get a letter of interpretation from a medical provider that defends a position of why you may not put it on your OSHA or MSHA log. So depending on the nature of the injury, especially this could come into play with delayed reporting, it helps protect your interests as you move forward. A lot of companies will use a third-party resource to assist them in coordinating their post-accident, post-incident drug and alcohol testing. Whether you classify it through that mechanism or you may also do it through probable cause or reasonable suspicion, making sure you have a vendor that covers all the different regions that you are operating in, have the capabilities to provide services, whether it be through urine or saliva or hair follicle to meet whatever requirements you need to. Having that component in place is very important because you want to be able to react, especially under CDL and DOT guidelines, because you only have a 3-hour window to get those services performed. And then the question is, what is the data management capability as of these different vendors you may be utilizing? Is it possible that you can have a single resource to do all these services so all your data is in a single resource regardless of where in the country that these services are being performed. Now, if you have an internal data management system, it could be a situation where you could set up an API link, but from a management and a tracking standpoint, as well as identifying trends and tendencies, data management can be an element of this entire structure that is very critical as you move forward so that we, again, have the most optimistic outcomes we possibly can. So let's talk a little bit about teletriage in more detail. A properly constructed teletriage program has medical professionals that will go through all the facets of the injury with the employee. They will determine if they are a good candidate for remote clinical care. In those cases, they will then provide the first aid plans of care on behalf of the employee. They will continuously be following up with your employees. The one real benefit of teletriage, beyond the fact that your employees are getting immediate medical attention, is you're also seeing more favorable follow-up. Typically, it's every 24 to 48 hours, which means that you have that employee having an alternate or progression in their plan of care real time, which means the treatment duration window shrinks significantly, which means they're under care for a shorter period of time, thus reducing your costs. It also allows a medical professional now to be the one who determines when care should discontinue, meaning that they have hit a standard where they are back to their original condition, no more medical treatment is available or responsible for them. These are all things that not only will enhance the employee experience, which creates that culture where the employees feel like the employees are taking proper care of them, but it also, again, creates accountability for you as the employer to make sure things are being managed properly. A good teletriage program is available 24/7, 365. The good ones also incorporate translation services. That way your employees can always be speaking in their native language. That provides a better experience for the employee throughout the process. Now, when you look at the variations in teletriage programs, we see historically that most teletriage programs can retain ownership of that employee anywhere from 7% to 60%. And I know that's a big margin between the two. The reason being is we traditionally see most insurance-based teletriage programs retain about 7 to 15% of cases under teletriage without the need to go to a clinic. Third-party resources, you significantly jump anywhere from 25 to 60%, which really allows you to have more control over the experience for you and your employees. The reason that you'll even see a big variation there is because you have some programs that are nurse-based, you have some that are physician-based. When you're dealing with a physician-based program, it allows companies to be a little bit more proactive in the plans of care that they develop on your behalf. Typically, physician-based programs will also bring in supplementary medical capabilities, such as having a licensed physical therapist on staff that can do things like home exercise programs, stretch and flex routines, which again enhance the deliverable to the employee where they feel comfortable with the services they're getting, but they're actually able to do that in a very proactive way so that they're getting very good outcomes. So when you're interviewing potential capabilities within teletriage, it's very important to understand what your needs as a company are and finding a vendor that can set up a program very specific so that we get these outcomes you're looking for. Because if you do it, your teletriage program can be your first line of defense. And if you are able to, as an employer, keeping 6 out of every 10 injuries sustained under teletriage, which means they're not going to the clinic and so forth, you can start seeing the advantages that this is going to have on your business. As I was mentioning, these are the 4 main bullets that you will accomplish with implementing a teletriage as part of your injury management program. Not only do you have the situation where the teletriage program is typically around 40 to 50% of the cost of going to a clinic, so you're having direct savings from that side of things. The fact that everything that should be done under teletriage will fall under the first aid umbrella now minimizes your recordabilities, which will improve your mod rate. These are typically claims then that are not filed with your insurance carrier, which means that you're also reducing your frequency of events, which has a positive impact. But the other part of this that I think is beyond critical, and I mentioned it earlier, is it gives your employees instant access to medical care 24 hours a day, 7 days a week. We always try to give the guidance to clients of having all incidents reported within 15 minutes. The key to that is whether you're sustaining a musculoskeletal or a soft tissue injury, a laceration, a burn. When you provide care in that time frame, it significantly changes the overall plan of care associated with that incident. Because if you get ibuprofen and ice on a soft tissue injury and you control that inflammation, the chances of needing a more aggressive plan of care goes down significantly. Same thing with a laceration or a burn. If you're getting medical guidance on how to properly clean the wound, how to properly apply the triple antibiotic cream, how to properly bandage it and protect it so you don't get an infection while at work, but then have a supplementary plan of care during their off hours to increase the healing process. These are all things that are going to have a significant impact on the aspect of how the injury is managing and what the outcomes are. So it's not only giving access to the teletriage program, but how you structure it and how you implement the culture as well to your employees and supervisors to make sure that they're utilizing the program properly as well. On the case management side of things, there are several key elements that come into finding the proper provider. Now, in my personal opinion, if you can find a single vendor to provide teletriage and case management, that is always optimal for continuation of care. It's a better experience for your employees, and there's better continuity of reporting to you as the client company. Beyond that, you really want to make sure that your case management provider has the appropriate nationwide clinic network. This should consist of everything from dedicated occupational medical clinics with proper capabilities. You will need to make sure that they have resources for after-hour and weekend treatment. It might also include specialty services, especially if due to the nature of the work environment you work in, you have the potential of debris in the eye. Possibly having ophthalmologists that can take stat work-related injuries is critical. These are all elements that should be incorporated in that nationwide clinic network to make sure that your employees are getting the proper care they need. Making sure these providers, whether it be through the actual clinic or through your case management component, understand OSHA, MSHA, FRA guidelines. What are the different plans of care that will trigger a recordable versus keep it under the first aid umbrella? Making sure your case management has relationships with these clinics so that they can interact with these providers even before your employee arrives to discuss things like what is their job description, what are those essential functions, frequency, how much time is left on their shift, when is their next scheduled workday, and talk about potential plans of care that can be utilized based off of the final diagnoses at the clinic. You want to make sure you find a provider that has that process in place because it will have a significant impact on the outcomes. And you want to make sure that they are in a position to work with you so that they can even communicate with your insurance provider, with your employees, even your operations staff as far as duty status and how to utilize them. Let that case management component do the heavy lifting for you. Those are processes that a medical professional should really be doing because they can take into account all the various different elements while still protecting the interests of the employee, but provide a much better structure and plan of care and duty status to make sure it's a win-win situation for all involved. As we talked a little bit on the claims side of things, claims administration is a component that I think can be a very valuable element. There's a lot of different elements that come into play in how you structure this. One of them being, how is your work comp insurance program structured? A lot of different work comp insurance plans do allow companies the ability to self-pay claims. Sometimes they have a provision in there you still have to do a report only. Some basically say, especially with a high deductible, the first 150,000 is your own. So how you choose to manage that on your behalf is up to you. The one nice thing, if you tie into a service that provides claims administration, is now you can take advantage of their discounted fee schedule as well. So not only are you going to be able to manage these things without going through your insurance provider, which eliminates some of the negative ramifications of this, now you would also be able to take care of the same discount fee schedule, so you're not paying basically the list price off the HICVA amount. So that's very important. Another couple aspects on the claims administration is a lot of those services will either file the first report of injury on your behalf, they will file claims on your behalf. That way these things are following a set process. You don't need to worry about whose roles and responsibilities are to do these tasks, because obviously the sooner that you make the decision that you want to file, either it be a report or a medical claim, you want to get that done as soon as you make that decision as possible. And every day that you delay that may delay an adjuster being associated with the claim, or how that claim gets managed as far as with the providers as well. So the claims administration, especially depending on how your insurance is structured, can be a very valuable asset to your program. There's just some due diligence that you need to do to make sure you structure it correctly. As I mentioned on the claims investigation, there are a lot of different third-party resources that can get involved to help you identify the contributing factors, which can go into preventing injuries, but then to find out the validity of you accepting them. And, a lot of them will even work with you to train your supervisors so that they can do a proper incident report, because the more key data you get on the front end of the root cause of an incident, the more likely you are to put in place corrective actions to prevent future injuries from happening. So when you look at the claim side of things, even though it's on the back end of an incident occurring, if you utilize these tool sets accordingly, what it can do to help prevent in the future can be very advantageous to your company. As I mentioned, the coordination of your post-incident drug and alcohol can be a very taxing situation, especially after hours, finding clinics that are available and certified to do it, ones that can do both DOT collections versus non-DOT. If you want to use instant, so you can get those instant negative results to return back to work. If you have employees that are working in remote areas and you might want to do a self-administrated program through, say, a saliva drug and alcohol, it's very important that you find a vendor that can handle all those needs, as well as customize it based off of your requirements. And as I had mentioned before, they're each, especially if you do project-based work, it's important to understand, does the site that I'm requiring have a different requirement? I might have to test under a different panel. They may have a situation where the testing needs to be reported through them. So then we have to have a good communication in place for you on those situations. So you might have a union employee where all the drug screening needs to be done through the union sponsored event. These are all real key elements that need to be part of your safety plan for each site requirement. And then it needs to be trained so that each of your sites can adhere to it properly, because we never want to have you fall under compliance for any of those situations. And that goes for your alcohol program too. A lot of companies are more likely to implement breath alcohol testing, especially if it's in a scenario where you think that alcohol could have been a contributing factor. But again, you want to make sure, however you set this up, whether it be from an internal resource standpoint or an external, you have each of these facets clearly identified with standard operating procedures, as well as what clinics are available to perform these, both during normal business hours as well as after hours, to make sure you're being compliant throughout. As we look, and I've been doing this now for nearly 30 years, you also want to look at, when you look at the contributing factors of injuries, are there things that you can do more from a proactive standpoint that are going to impact your injury management program? And this is where you get into your complementary services. Your complementary services can be very beneficial in hoping to reduce the severity or reduce the occurrences of work-related injuries. As I had mentioned earlier, with how you evaluate your last 3 years loss run data as well as your incident reports, if you are of a company see that you do sustain a lot of injuries within the first, say, 90 to 120 days on the job, it may be a situation that you run into that you could potentially be hiring people that just do not have the ability to perform the essential functions of the job. Constructing a more robust pre-employment post-offer evaluation that may include a physical ability program, and a properly functional physical ability program is designed specifically to the essential functions of each job description, which is a key element, because if you do it that way, if it's a validated study specific to a job description and everything you test on that physical ability test is specific to that, you are ensured that you're going to meet all the ADA and EEOC requirements. And that allows you to ensure that you are bringing on people in specific roles that can handle the physical nature of that role. Now, you may find a good candidate that can do everything but maybe one task. Well, this is where you figure out if you can make a reasonable accommodation. Or it may turn out that this is a good candidate and you might put them in a lesser role that doesn't have the same physical attributes. So it gives you a lot of flexibility to put candidates in the right position where they can be good functional employees, but not put them in a position where they are going to be a potential work-related incident. Return to duty and fitness for duty is another element. We see this a lot. We see a lot of injuries that are people that are employees that are coming back for a non-work related issue. And most companies just have a process that employee needs to come back with a release from their doctor, and they just put them back to work. 20 days later, you have an aggravation of a pre-existing condition, which is now is your ownership. Implementing a set process where you have a medical provider as your partner to do a third-party evaluation of these employees to ensure they can do all the aspects of the job should significantly reduce those re-aggravation of pre-existing conditions. And then your fitness for duty is a tool that can be utilized by your supervisory staff if they ever have a concern if an employee is able to perform the essential functions. It might be an employee that comes in one day with a knee brace on, or an employee simply says, hey, I kind of tweaked my back over the weekend. Can somebody help me do these tasks? A lot of employers just allow these people to continue to work, and then when they aggravate that condition, it's yours to own. So a return to duty and fitness for duty is another element that you can incorporate to lessen those events from happening. Ergonomic evaluations is a real tool that can be used to do job site assessments and task analysis, especially if you see a trend where you say, hey, we've had now 7 shoulder injuries over the last 6 months doing a very similar task. Having somebody else going out on site to evaluate the tasks, how they're being performed, put in place corrective actions to lessen those events from happening is now even taking this another step further, where we're not properly just managing injuries as a company, but you're putting in steps to help eliminate those injuries from happening on the front end, which goes into your risk assessments, looking at contributing factors to the environment in every different aspects. Because again, the best injury to manage is the one that doesn't occur. So anything that you can do as part of those will be very foundational on how your program can operate for you. And then there's also the post-treatment review. Reviewing your reserves. You know, I've seen this over the year. There are so many companies who really don't investigate why reserves are still on their books. And I've seen it where we've had a simple sprained ankle still being logged on a company's reserves 3 years later. You need to evaluate that, and you need to defend your position why these reserves need to be taken off, because it will in fact impact your insurance premiums. So constantly monitoring those, whether it be quarterly, biannually, annually, is very critical, as well as if you want to have a third-party resource to help you review your logs, making sure that everything that you have listed is specific to the occurrence and you are logging things correctly, because we don't want you to take unnecessary hits on your log when you don't need to. And sometimes a third-party resource to review those along the way can be very valuable, so that we are managing things on the back end as well that can have a negative influence on how your injury management program performs. Our goal throughout today is really to hopefully give you a top-level overview of some of those elements that each company should take into account when they're evaluating their existing program versus some of their objectives of what they want out of their injury program. I cannot stress enough, it can be a balance. You can find a good balance between creating a great culture for your employees because they feel like they're being taken care of, but now you as the client company have resources in place to protect your interest as well. And that's really the goal here. We want to make sure both sides are taken care of. And hopefully throughout today, as we've talked on some of these topics, really from more of a 20,000 foot view, it will help you think about different areas. Maybe you have gaps in your program that you would want to address, and how you may want to look at structuring your program, and what are the resources you can bring in to assist you in this process. So hopefully this gives you a good overview. If there's any questions at this time, I will be more than happy to address anything I can. If I can be of assistance in the future, I'm always available as well. This is something I've been doing for a good part of my career. I have a very vested interest in it, and I love to be able to help out companies, develop and implement these programs to everyone's benefit. Thank you for your time today.
Amazing, Mike. Thank you also for your time this afternoon. We appreciate you spending the afternoon with us and sharing your valuable insights today. We do have a ton of great questions that have been coming through, so we'll dive right in. I know we have about 15 minutes here. So folks on the line, if you have any additional questions, please feel free to keep them coming. All right, so Mike, first question that I'm seeing here is, in reviewing reserves, what trends and red lights should we be taking into account?
So the main thing that you look at from reserves is, I always look at what was the original incident date, what was the date that they were discharged from treatment, and then what is the time frame from when they completed treatment to the date that you reviewed the reserve. Typically, when you look at some of the guidelines that we will adhere to, is typically the first parameter we look at is the 1 year rule, that you can reopen an injury claim within 1 year of the original incident date. So that's one benchmark we utilize. But if we determine it's a fairly minor injury, and let's just say it was reported with your insurance carrier and you've gone through all that aspect, and the treatment time was 1 month for the course of treatment, typically I will always, if it's less than a year, I will look at it as a multiplier of 3. And typically anything after 3 months, then you should be looking at either a reduction in the reserve amount allocated to that injury, or you have justification to remove it from the reserves altogether.
Perfect, Mike. Thank you so much. Another question that I'm seeing coming through is, what kind of training and awareness materials can be provided with injury management programs?
So when it comes to that side of things, it's very, very important that everybody involved within an organization, first and foremost, knows any of the state or site requirements you have to adhere to. I recommend that you write that into your safety plans, because that way everything is in one place. But as I had mentioned before, if you're working, let's just say in the state of Georgia, you have to provide a clinic panel of 6 facilities for the employee to choose from. But besides that, it has to be documented on a very specific form, and it has to be provided at the time of the incident, as well as I also like to have a validated waiver that the employee signs off on, that they actually reviewed the clinic panel and they chose from the clinic panel. I love documentation from that standpoint. It's also important that each one of your supervisory level people or higher also understand the state regs as it relates to your directive of care, because you want to educate the employees on that. Because again, if you're in the state of Indiana where you get to direct care for the first 500 weeks, you need to make sure the employee knows that, listen, we are in a position where we will provide you the optimal medical care, but it has to be through our direction based off the state guidelines. And you have to inform them that if you do seek medical treatment outside of our guidance, you may be personally responsible for any of those visits on your own, whether it be the cost or if they take you off of work. And that's vastly different than in Illinois, where you get to direct the care for the first visit. But in those states, a lot of times employees might say, well, I'm fine. I don't need to make medical care. You still have to make sure that those employees understand that, okay, we understand you're declining right now, but please understand we get to direct care for this first visit. So if you're going to seek care on your own, it still has to be through us, the employer. Otherwise, you may be responsible. So all those provisions, as well as site requirements, if you have to adhere to a project site, making sure those are documented very well into your safety site safety plan is critical. Plus, if you're using a teletriage service, if you're using a case management service, making sure that all the supervisors and employees know the standard operating procedures that they all have to adhere to, so that you're creating that culture from day one so you get better outcomes.
All right, amazing, Mike. Thank you so much. That was a great response to that question there. Another question that I'm seeing coming through is, will a clinic take direction from someone that is not the employer?
That's a great one, because it really depends on what you do setting up the foundational aspect of your program. If you're using a case management service, typically it's that case management service that are setting up the clinics on your behalf. Or if they're incorporating clinics that you have historically used into their network, then they will reach out, develop a standard operating protocol with that clinic, so that now that case management group is the dedicated contact, which gives them the allowance to be able to communicate on behalf of you as the employer to manage those claims. So it's much easier if you set that up in that foundational, versus if all of a sudden you decide that one day, oh, I've got an injury here, we don't have any safety people out there, I'm going to call someone to help me. If they typically don't have it registered with the clinic, it will make that communicate much more difficult, which is setting up that foundation and committing to an approach is so important on the front end.
Perfect. Thank you again. Another question coming through. How is treatment under the teletriage considered first aid?
So that goes to what I talked about between teletriage, telemedicine, and telehealth. Teletriage is a term utilized, which means all the services provided as part of teletriage is considered first aid and is readily available from a plan of care standpoint under first aid. So with that being said, even when you look at things like, if you have a teletriage vendor that does home exercise programs or stretch and flex routines, there is a very distinct difference between those programs and how they're prescribed or administered versus, say, a work conditioning program at a PT clinic. So it's very important that you make sure you find a provider that falls under that clarification, because if you work with somebody that falls under telemedicine or telehealth, which means that they have state certifications in every state and they prescribe a very similar program, because it's now considered under a prescription because it's state self-guided per the state, that could be constituted as a prescribed or a prescription-based service, which will now create a recordable event. As well as everything under teletriage, especially from a medication standpoint, is all over the counter. So that's when you're going to see 400 milligrams ibuprofen as directed versus a prescription for 800. You're going to see plans of care using over the counter, antibiotic creams versus something prescription. So it really goes into how the plans are described and then how they're administered state by state.
Wonderful. Thanks again, Mike. And folks on the line, thank you so much for these wonderful questions. Please keep them coming. This is a great Q&A discussion. Mike, next question that I'm seeing coming through. Can I mandate a staffing partner's nurse triage to get approval from the host employer when escalating minor injury for medical treatment?
Absolutely. And that should actually be part of the onboarding as part of any outside vendor you bring on, is developing those standard operating procedures. You will have some companies who basically will say, at this point here, they're giving the third party resource carte blanche to manage it on their behalf. You also have a lot of companies who will say, okay, we want you available to do all the teletriage, but once you do make the determination that the care required goes beyond teletriage and it needs to go to the clinic, here is the reporting. You need to contact XYZ individuals within the company, and it can be based off of site location. It can be based off of region, division, whatever it may be. And then at that point there, then that point of contact will reach out to your company and saying, based off of the information we gathered, we believe the proper course is to get them into the clinic for evaluation. And then it could be a situation where then that company may then take it over from there. They may still want that third-party resource to direct care, but they want to at least acknowledge that it's a situation that needs clinical intervention, as well as if it needs something above and beyond clinical care at the dedicated occupational medical clinic, and they need to either get an MRI or a CT scan, a specialist. You can put all those standards into those standard operating procedures. That way, each injury is managed the exact same way. And that's what a good third-party vendor will do for you, is establish those guidelines right from the get-go.
Great. Thank you, Mike. I know we're getting close here to the top of the hour. We have a couple more questions that we're going to try to squeeze in here for the final few minutes. So Mike, the next question, does a temporary worker or subcontractor count on my recordability log?
I get this one all the time. It really comes down to one provision that I've worked with, especially on the OSHA side of things. If the employer is directing the schedule for the temporary employee or the subcontractor, which means it is documented that they have to be there Monday through Friday, 8 to 5, if they are providing that level of guidance, then what happens is anything that happens with that subcontractor or that temp employee flows up into that company's log. So from that standpoint, if you know that you're going to be controlling their schedule to that extent, I highly recommend you work with either the subcontractor or the temp company so that you can incorporate the directive of injury care under your program so you can control the outcome. Because the last thing I want to have happen to an employer is the temp company is in charge of managing the injury, but the upflow ramifications are affecting you as the employer. I highly recommend you put that in as a provision of the contract with them, that if you're controlling their schedule, you get to mandate how injury care is being provided.
All right, wonderful. And we are down to our final question here with the next 3 minutes left. So Mike, final question that I'm seeing here in the queue. Can you deny a claim if an employee does not report an injury in a timely basis?
This is where it's very important to establish a very good rapport with your insurance carrier up front. If you're working with a good provider from the standpoint of managing your injuries, which is going to be documenting not only when the incident occurred, but what the course of treatment was, and you have the documentation, and you've got an insurance provider who will work with you and take those letters of interpretation, yes, you can. Because if there's a position, and let's just take one that I was involved in not too long ago, we had an employee come in on a Tuesday. They said they hurt their shoulder about 2 weeks in advance. As we found out through doing the due diligence, that employee not only was delayed in reporting, but for 5 consecutive days before they did the reporting, they were on a whitewater rafting trip. So when we talked, we decided to still send them into the clinic so that they could be evaluated. We talked to the medical provider. We told him of the scenario, and he said, there is no way that this injury was 2 weeks old. He goes, the inflammation in the shoulder joint is maybe 48 to 72 hours old. And we were able to take all that documentation, package it up, provide it to the company's insurance provider, and the insurance provider was able to deny the claim based off the research we provided on their behalf. So yes, you can do it, but the documentation has to be in a certain way that your insurance carrier can use that to deny the claim on your behalf.
All right, wonderful, Mike. Well, that was such a fantastic Q&A. So thanks so much for everyone who submitted questions. Really engaging conversation. Thank you again. And Mike, any final comments on your end before we close out of our session today?
No, the only thing I will tell you when it comes to injury management, it's all about being proactive versus being reactive. And the other thing is please don't ever think there's a dumb question, because you would be surprised at how minor of a scenario that you may think it is in your mind can positively impact how your program operates moving forward. So explore every avenue, make sure you construct it specifically around what your needs as a company are, and make sure that when you're finding vendors, you do your due diligence so you find a good partner, because at the end of the day, that's what they will be to you, is they will be your partner in this process.
Amazing, Mike. Thank you again so much for spending the afternoon with us. A huge thanks to our audience members as well for joining us for the last 2 days for our EHS Now Summit. And a huge thanks to our session sponsor, Examinetics, for helping make this event possible. Now, as I mentioned in the beginning of our session today, we did record the entire presentation today. So if you do wish to preview it again or pass it over to a friend or a colleague, you'll have that recording in hand in about 24 hours coming to you via email. So keep your eyes open for that. And don't forget to check out the resource widget on your screen for a great free white paper provided to you by Examinetics as well. Some great information in that white paper there. And there is a link to their website in the resource widget as well if you do wish to learn more about our session sponsor. Thank you all again for joining us. Thanks to Mike, and thank you to Examinetics. I hope you all have a great rest of the afternoon. Thanks again.